them really well. And so many of them would tell me that they loved the content of OB-GYN, but they would never go into the specialty because they were concerned about the culture of OB-GYN. And when we say culture, they specifically mean issues about the view of life, honoring the sanctity of life, honoring conscious rights, and these types of issues. And
welcome to Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists, or APLOG. On this podcast, we bring on experts to provide insights to support you as a medical professional in your life-affirming practice and career. I'm your host for today, Dr. Christina Francis, a board-certified OB-GYN and also CEO of APLOG. You may notice that we're not using the same remote setup as usual. That's because I'm recording in person with our guest for today at our Matthew Bulfin Educational Conference in Orlando, Florida. So happy to be here today with Dr. Francis Nuthalapaty. He's a double board certified physician in obstetrics and gynecology, as well as maternal fetal medicine. He also serves as the founding program director for the OB-GYN residency program at his Florida hospital. And I'm so excited to have you on, Dr. Nuthalapaty, to discuss ways that pro-life physicians can support medical residents in our current medical culture, especially as it pertains to the issue of abortion. So, Dr. Nuthalapaty, thank you so much for being here with us today.
well, thank you, Dr. Francis, for having me. And I just want to say I'm so excited. This is my first time attending your educational conference, and the content has been wonderful. The fellowship with like-minded people has been amazing, and I just commend you for this good work.
Oh, thank you so much. We're so glad to have you here. It's been a great conference so far, and let that be an encouragement to anyone who hasn't come to a conference to come next year. So, well, let's just start out with a really simple question. Can you just tell us a little bit about yourself and then also your work and what you do teaching medical residents?
Yes, thank you. So to reiterate, I am a maternal fetal medicine physician, and my passion has always been around medical education. I'm actually an immigrant, and my parents were both educators in India. I came to this country at a young age, and I would say that they influenced me very much about thinking deeply about education and always striving for excellence. I was always great in STEM, and I think that my parents encouraged me, maybe in the womb, to become a doctor.
Sure.
Took that path in high school. But it's really during medical school that I came to understand the complexities of medicine and the opportunities that we have, and felt a calling towards OB-GYN. Would have never thought that that would be my career. I was thinking about cardiology, actually. My father passed away of heart disease when I was in high school, and that was where my passion lay. But when I experienced the field of OB-GYN, the miracle of birth, on my rotation, I knew that that was my calling. That's also when I discovered maternal fetal medicine, working with a few doctors, and I knew that that's where my long-term career would be. I was very fortunate in my residency to do it in a place where there were medical educators, people passionate about that, and that has been my passion since then.
Oh, that's so great. I think as you're talking, I know I've talked to so many people who think, man, if you're pro-life, how on earth could you go into maternal fetal medicine? Can you just tell us briefly what your experience was through your fellowship training and maybe what you feel that brings to your practice now, actually, as an MFM?
I would love to elaborate on that. Now, I was born in a faith home, in a Christian home, but I'll confess that I didn't really understand anything about my faith. I just identified nominally with it. And as I went through medical school and even my residency, it really did not form a big basis for the way I looked at the world. During my maternal fetal medicine fellowship, actually, is when I really came to understand my Christian faith and dedicated to grow in it and be a follower of Christ. And around that same time, something life-changing happened. And it was during my first year of MFM fellowship. My wife, Elizabeth, took our second child, Eden, to her 15-month pediatrics appointment. And I was at work that day, and she called me. And usually, when she calls me in the middle of the day, it's because she needs me to bring some milk or eggs or something, on the way home. But this time it was different. And she said that the pediatrician was very concerned about Eden during the checkup. and that she had an enlarged liver, an enlarged spleen. He had done a quick blood test and found her to be very anemic and a low platelet count. And that day, he wanted Eden to go to the Children's Hospital because he was very concerned that she might have a blood cancer. And so, I dropped everything I was doing, headed to and met them at the pediatric hematology oncology practice. And he told us, yes, I think it's a blood cancer, and we'd like to do a bone marrow biopsy tomorrow. And so we were just in shock, and we had the biopsy done the next day, and seemingly just, minutes later, the doctor came back and said to us, I was wrong, it's not a cancer. She has a very rare genetic condition called Gaucher's disease. And, in some ways it's reassuring to get that diagnosis, but then it just set us down a path of uncertainty about, how her life would be. Thankfully, there was an enzyme replacement therapy for her. But that diagnosis and the months ensuing were very difficult for us, Dr. Francis. And it was during that time that I really struggled to understand, why those kinds of things happen to people and so unexpectedly. But it was an opportunity for me to contextualize these things from a faith perspective. And actually someone in my church knew that we were struggling with this issue and pointed me towards a verse in the Bible, Psalm 139. And as I read through that verse, I was so convicted because what I understood is that when that verse says that we are fearfully and wonderfully made, that it implies that each person is made perfectly in the womb. And when I was looking at my daughter, prior to knowing about the diagnosis, I believed that about her, that she was perfect. But after hearing about her diagnosis, I was looking at her differently, as if she was imperfect. And I was so convicted that that was the wrong way to look at my daughter, that God had made her that way perfectly. And that really helped me start that journey of healing and understanding better that this was just the way she was meant to be. And she was perfect in every way, and her life would be a great testimony. And in fact, that situation changed my entire view of every patient that I ever encountered. In maternal fetal medicine, our business is to walk into rooms and change people's whole view of their pregnancy. Right? Sometimes we have to tell them that there's something going on. Well, prior to my experience with my daughter, I embraced the contemporary teaching, which was to use words like anomaly, malformation, problem. After my experience with Eden, I don't use those words anymore. When I have to go and talk to a patient about what's going on with their baby, I'll say, we looked at your baby, and I'm going to tell you that I'm seeing something which is a bit different than what I usually see, but let me just explain what that means. A simple change in the vocabulary makes such a huge difference in how a patient views the situation. And that's been the most powerful thing that's been a result of my experience with my own daughter. And sometimes that opens the door for me to even talk about Eden with the patient. And so I am so passionate that that's what we need to do in the medical profession. Help people see that each of us is fearfully and wonderfully made and honor their life.
Absolutely. Man, what a powerful story. And I think also speaks to the power that we have as physicians in our patients' lives, and even just the words that we use when we go into a room and we talk with them. We I think it was last year sometime did a webinar about trisomy 18. And on that webinar had this amazing family who has a daughter with trisomy 18 who's in her teens. And her father said something that really stood out to me. And he said, I get really upset when people call my daughter a fetal anomaly for two reasons. She's not a fetus and she's not an anomaly. She's my daughter. And that really impacted me. And I just thought, words mean so much. And not only how the family perceives them, but I think how medical trainees then perceive how they should be viewing these fetal patients that we're taking care of. As OB-GYNs, we take care of 2 patients when we're taking care of pregnant women. So not only how our medical trainees view those patients, but also how they learn to talk to patients and try to understand what those patients are going through. So you are working with with OB residents now, right? Tell us a little bit about your program and what struggles do you see with your residents? Of course, we're focused on the topic of abortion, but as an organization, but just in general, what are some struggles you see with your residents that you're trying to address and support them in?
Well, thank you. I would actually like to step back a little bit and give more context to my response.
Yeah.
And that is that before I started a residency program, I actually worked in the undergraduate medical education realm at a medical school and directed all of the OB-GYN programs for an obstetrics and gynecology department.
Awesome.
I love that work. I did it for a decade. I got to meet with the students, twice during their clerkship, and I got to know them really well. And so many of them would tell me that they loved the content of OB-GYN, but they would never go into the specialty because they were concerned about the culture of OB-GYN. And when we say culture, they specifically mean issues about the view of life, honoring the sanctity of life, honoring conscious rights, and these types of issues. And when they surveyed the training options, they found that they were very polarizing. And by and far, most of them didn't honor those tenets that these students believed in.
Yeah.
And so, tragically, a lot of them would choose family medicine or pediatrics as an alternative. And that really grieved me.
Yeah.
And that's when I really started thinking, we need to be examining what's happening in graduate medical education and trying to have an impact there.
Yeah.
Because we need to give an option for students of these viewpoints to feel safe in training.
100%.
And so that's when I started praying about the opportunity opening up, and eventually that's how I ended up where I am now and starting a new program at a faith-based institution, which gives me a lot of opportunities that I wouldn't have otherwise, I think, in a secular organization.
Yeah. Absolutely.
So specifically, with the residents that I try to recruit, I number one tell them, no matter what your persuasion is, you'll find a home here. It is truly welcoming. And especially if you're a person of faith, if you have strong moral convictions around these issues, you'll find a home here, right?
Yeah.
We're going to give you excellent training across the board, how to be an excellent OB-GYN, but we're also going to focus on the spiritual aspects of what it is to minister to patients, and talk about that interaction between the patient, physician, and society.
Yeah.
And it's been a message that's been so welcome from so many students. I think they're starting to realize, wow, there is an opportunity to train in a place that really embraces my worldview. And then I think that's been the greatest part about being able to start a residency program like this. Just although it's a little bit of swimming upstream, it's very much worth it.
Yeah, absolutely. Well, it has to be such a breath of fresh air to so many of these students that are applying, because we're hearing the same things that you were hearing. Students just so afraid to speak up, or so afraid to, as you said, even go into the field of OB-GYN, because they are afraid that they are going to either be forced to perform or refer for abortions or do things that violate their conscience, or just be in that general culture, like you said, where they can't be themselves and they can't truly practice medicine in the way that they know is best for their patient. So I can only imagine it has to be such a breath of fresh air for them, and to be able to incorporate as well, as you said, the spiritual aspect of thinking, this is not just about making a diagnosis and giving treatment to patients. It truly is a vocation that we have been called into. And so that means, as you said, ministering to our patients, taking care of them as a whole person. The theme of this conference is coming back to the way of medicine and seeing medicine as this vocation that we have been called to, that we truly are privileged to do. And I think, I don't know about you, but as I look around at my colleagues and other physicians that I interact with across the country, I think the joy has gone out of medicine for so many people. We see burnout, and I think a lot of that is because we've lost our way as a profession, and so much of that has to do, I think, I don't know what your thoughts are, but with losing sight of the value of our patients, the dignity of our patients that we take care of.
No, I love what you're saying, and I think this conference has emphasized this Hippocratic view of medicine and how far we've gotten away from it. And I would agree with what you've said, that when we lose that Hippocratic view in our practice, then that leads to a lot of negative consequences. But I'll tell you this, there's no better way to be edified and encouraged than investing in the next generation. The other option is to just ignore them, in which case I think within a generation medicine will be forever changed and will forever lose that Hippocratic view, right? Yeah. But if we, no matter what situation we're in, we don't have to be in academic centers, but if we're out in practice in a community, we have to find ways to engage with the younger generation.
Absolutely.
If you have a high school in your community, I'd say go and find out when career day is and go and interact with the students at the high school. If you have a college, find out if they have a pre-med interest group and go and talk to that interest group. Help them see how you view medicine. Help plant those seeds, because they are not hearing that necessarily within the context of their training programs.
Right.
Same thing with a hospital. If there's a hospital in your community, there's a residency program, find out if they'd welcome a lecture. Maybe make it about business, but use it as a vehicle to talk about the bigger aspect of how to practice medicine.
Absolutely, absolutely. Well, and as you said, I think it is so important, because I do think we find ourselves at this moment for our profession where we have a chance, a real chance to make a difference. There are so many students and residents, I think, who they went into medicine for the reason that we all did, because we really desire to take care of patients, and they're seeking this deeper purpose and meaning to that profession, and so they're waiting for us to show them that it's possible to practice this specialty, especially if you are pro-life, if you value the lives of all of your patients. And I think just normalizing that for them as well, and showing them this is the way the vast majority of us practice, and it's actually the best way to provide health care for our patients. And as you said, interacting with them, mentoring them. I think the need for that mentorship is so huge for the next generation, so that they can navigate the waters through what, sometimes is a bit of a rocky profession, with all of the red tape and things like that we deal with. We need to continue to be nurturing them in the joys of this profession as well, and what it looks like to truly care for our patients. I think in just the last couple of minutes that we have, what would you say to maybe a high school student or a college student or even a medical student early in their career who hasn't chosen their profession, about if they are pro-life and they're listening to this, and especially if they're in a state that maybe is very hostile towards the pro-life view right now, what would be your biggest pieces of advice for them as they navigate the waters? Many of us are sort of loud advocates for life, and I'm blessed to be in a position where I can do that. Sometimes that may not be the best thing for somebody who's in medical school at the time to do. So what would be your biggest pieces of advice for making sure that they can get through their medical training, but also not violate their conscience, their beliefs, and their morals?
Yeah, that's such a good question. And I would say that I've certainly learned those lessons going through my own career as a student, resident, fellow, and even a faculty. And there's one verse that I often meditate on, and that is that we are called to be wise as serpents and innocent as doves. And I think a lot of us who uphold, a high moral standard are pretty good with the innocent as doves piece, right?
Right.
And we really believe in treating people well and not responding in anger. But a lot of us need practice on being wise as serpents. And that is knowing when to engage and how to engage. I think that's an important part of what your organization does in providing training about that issue, right? How to be more wise. Now, what I think all people need to do, though, is start thinking more deeply about the bioethical framework for these issues.
Yeah.
Because that is the stage on which we debate these issues, right?
Yeah.
No matter what your background is, whether you're a person of faith or not, or whatever your moral standing is, you need to have an appropriate bioethical framework in which to talk to people about these issues. And I think that that can be developed even at the youngest of ages. It doesn't even have to be high school, but we can talk to people about them in middle school, high school, and thereafter. Because unfortunately, in formal higher education training centers, they don't necessarily present the whole bioethical framework on which
Right.
we talk about
Yeah.
these issues. And I think your friend Scott Klusendorf is a great example of someone who
Yes.
does present an effective argument rooted in bioethics.
Absolutely.
And I think that's the opportunity. Become a fan of bioethical understanding. Or really train yourself in that area, and then practice discernment. Be wise as a serpent and know how to engage and when is the appropriate time to engage on these issues.
Yeah, absolutely. I completely agree. And I think that that gives us confidence too as we talk about those issues that, obviously both you and I are people of deep faith, and that certainly informs our view of the value of human life. But I know, for people who maybe aren't people of faith or are, but don't want to just use that argument, I think also having that bioethical framework, which of course is also rooted oftentimes in biblical values, but having that and having the medical evidence and the data, those are all key components to really being able to make a confident argument when that needs to be the case. The other thing we often tell people is, if you already know that you might be a little bit more under the gun as far as people sort of watching what you're doing, also be sure that you're an excellent student and you are prepared for your rotations and all of that, because we want to show that yes, we value life. We are also excellent physicians. Those two things are not in opposition. They actually go hand in hand. But I agree with you. I think one of the things that is lacking oftentimes in medical education is a truly robust training in bioethics. And that informs obviously so many more issues than just the abortion issue. So, yes.
I wanted to add one other thing.
Yeah.
And that is, in my own life, I told you that I didn't really come to a full understanding of all of these issues. In fact, even when I was done with all my training, that's when I really started studying them. I want to encourage young people especially to give themselves grace. I think it can be daunting and maybe even discouraging to people if they see that, boy, this is such a complex environment. Maybe I don't want to go into OB-GYN. Maybe I don't even want to go into medicine. Don't do that, right? Be encouraged that you don't have to be perfect. You don't have to know all these things. But if you in your heart really believe that it's important to provide loving, compassionate care to people and that you value all people, then you're exactly the person that we need in medicine. And give yourself the grace and the time to learn about these things as you progress through your training and career.
Absolutely. Such an important point. Yes. Thank you so much. You're exactly right, because in the hard moments, that's what's going to really matter, is that compassion that we have for our patients and being there to support them. I know, just really quickly, you are also involved with the Christian Medical and Dental Association with the OB section. Is there anything you'd like to sort of plug on behalf of that, or maybe any students or residents that are interested in OB?
Yeah, I can tell you as a whole, the Christian Medical Dental Association is really recognizing that there is a sense of urgency about investing in our young people. And so our main push now is to engage with people who are in practice and try to train them and let them know there are so many opportunities for you to mentor and engage with people who are currently in training. And we're a great organization if they're interested in looking at us, but I would say your organization, I feel, has the same principles and the same kind of ethos and urgency about investing in young people. The most important thing is to know you're not alone. There are people who want to connect and help support you through the journey. Absolutely,
absolutely. And so for any students that are listening, know there are there are heads of residency programs out there like Dr. Nuthalapaty who will be supportive of you and walk alongside you in your journey through medicine, which I'm sure you're in the same boat as me. I can't imagine having chosen any other line of work. So it truly is a joy and a privilege. And it was such a privilege to have you with us today, Dr. Nuthalapaty. We're so thankful for you for being here with us.
Well, thank you, and congratulations on pronouncing my name so well.
Well, thank you. I practiced several times before we started. So yes, thank you so much. And thank you to our listeners for joining us today. If you liked this episode, please be sure to give us a like and a subscribe on YouTube, or if you're listening on a podcast app, please be sure to give us a 5-star review. We'll see you on our next episode.